Hello everyone. Today I am going to start a new topic, that is atelectasis. In this video, we'll see about the definition, etiology, pathophysiology, clinical manifestations and the management. Definition of atelectasis. It is one of the medical condition. In this condition, what happens? There is a partial or complete collapse of the lung, or a lobe of the lung will be collapsed. It ultimately leads to decrease in the oxygen levels of the body, and what can be different symptoms will be seen in this condition. It is known as a atelectasis. It is a complete or partial collapse of the lung, or a lobe of the lung will be collapsed. Main causes include obstruction of the airway with the mucus plugs or tumors, or compression of the lung, such as with the fluid or air in the pleural space, or lung diseases. For example, pneumonia, and in case of bronchitis, what happens? There will be complete or partial collapse of the lung will takes place. Next, etiology of atelectasis. What are the main causes of atelectasis? If there is a airway obstruction, for example, if the patient is engulfed with some foreign body or obstruction with any mucus plug or any rise of tumor, it leads to the airway obstruction, thus it leads to complete collapse of the lung. Compression of the lung. In case of pleural effusion, pneumothorax and tumor, what happens? The entire lung will be compressed. So, it leads to the collapse. Decrease in lung expansion, such as the neuromuscular disorders, chest wall abnormalities, or postoperative pain. In these conditions, what happens? The lung expansion will be decreased. And decreased surfactant production or function. For example, if we'll say the premature infants, what happens? There will be the decrease in the surfactant production. And in case of ARDS, that is acute respiratory distress syndrome, also the collapse of the lung will takes place. These are all the main causes which involved in the formation of atelectasis. Pathophysiology of atelectasis. What happens in this? What is the mechanism involved in the atelectasis? It is caused by the collapse of lung tissue, leading to the decreased ventilation and oxygenation. Here, due to the airway obstruction, the bronchioles will not allow the air to flow. Thus, it leads to the collapse of the lungs. Here, it involves mainly three mechanisms: obstructive atelectasis, compression atelectasis, and adhesive atelectasis. In case of obstructive atelectasis, it is caused by the blockage of the airway, such as here, any mucus plugs or any rise of tumors or any growth of tumors or any foreign body obstruction happens, means there will be the obstructive atelectasis. Whereas in compression atelectasis, what happens? If any external pressure on the lung tissue, in case of any pleural effusion or pneumothorax, the external fluid will be formed. No? In this area, what happens? There will be the compression over the lungs. Thus, it leads to the compression atelectasis. Whereas third type, the adhesive atelectasis, it is caused by the surfactant deficiency or dysfunction. In case of premature infants and all, we can observe that there will be the decreased supply of surfactant. So, it ultimately leads to the adhesive atelectasis. After atelectasis happens, what is the effect we will observe? Hypoxemia, pneumonia, and respiratory failure. These are all the main complications involved after the atelectasis. Hypoxia means there will be the decreased oxygen supply to the tissues. And in case of pneumonia, if there is an increased risk of infection due to the secretions or decreased immune function, if the atelectasis will happen, means it leads to pneumonia. And in case of severe hypoxemia and hypercapnia, it leads to respiratory distress and organ failure. These are all the effects of atelectasis. Mainly, mechanism includes three types: obstructive atelectasis, compression atelectasis, and adhesive atelectasis. Whereas the complications of atelectasis involves hypoxemia, pneumonia, and respiratory failure. Clinical manifestations of atelectasis. What are the main signs and symptoms we can observe in the patients? Dyspnea or difficulty in breathing, and central cyanosis will be observed. Complete bluish discoloration will be seen. Chest pain and the discomfort, especially on the affected side. If any injury to the chest wall area under, we will see the discomfort. Cough, that is dry or productive of sputum. In some cases, we will be observed that blood-tinged sputum will be seen. On auscultation, what we will feel wheezing and the abnormal breath sounds will be heard. And if the complications further proceeds means it ultimately leads to pleural effusion and the empyema. Diagnostic findings. In case of this atelectasis, first and foremost, the important thing is history collection. In this history collection, we need to collect the complete history from the patient regarding his medical conditions and all. In the physical examination, we need to observe any discomfort or chest pain. If the patient is complaining any wheezing or any abnormalities, we get fine. We need to report to the physician. And in the chest X-ray, there will be the we can observe that collapse of the lungs will be seen. CT scan, pulse oximetry, there will be shown decreased oxygen saturation. And in case of bronchoscopy and blood gas, in case of bronchoscopy, we can observe the collapse of the lungs by visualizing any obstruction or any tube. Or finally, in case of blood gas analysis, we can monitor for PaCO2 and PO2 values. Thus, we can administer according to that values. Management includes medical management, surgical management, and nursing management. First and foremost, medical management. It involves remove the secretions by coughing or suctioning. If any secretions that obstructing the airway, we need to encourage the patient to cough first. We need to suction the airway. Chest physiotherapy. Here, what happens if we are going on patting the lung area and all, if any excessive secretions that are blocking the airway, it will be cleared out. Nebulizer therapy with bronchodilators. It helps us to dilate the bronchi, thus it clears the airway. Sodium bicarbonate may also be used to remove the secretions. If any secretions that are obstructing the airway, the sodium bicarbonate will easily smoothen that airway. To remove the obstruction, bronchoscopy is performed. If any obstruction with the foreign body is observed, the bronchoscopy can be used to remove that foreign body. Finally, if all the measures are failed, we can go for endotracheal intubation and mechanical ventilation. Next, thoracosynthesis. Due to any fluid accumulation like pleural effusion and all, the collapse of lungs will be taking place now. So, in order to remove that, we need to perform the thoracosynthesis. Some needle will be inserted to remove the excess fluid. Surgical management. Surgical management involves, if the atelectasis is chronic, the lungs cannot be re-expand. The lungs is difficult to get the re-expansion. But if some part of the lung is affected, the lobectomy can be performed to remove some part and segmental resection can be done. Next, nursing management of atelectasis. First of all, we need to assess the respiratory status, whether the patient is taking the respirations normal or any abnormalities we need to observe. Then monitor for saturation, PaO2 and PaCO2. By monitoring these values, if any abnormality is found, we need to correct that values. Administer the oxygen if required. By monitoring with the pulse oximetry, if any abnormalities in the oxygen saturation, we need to administer the oxygen according to the prescription of the physician. Administer medication as ordered. We need to check for the physician's prescription and we need to administer the medications as ordered. Check the need for invasive oxygen therapy and educate the patient to perform deep breathing exercises. This will helps us to formulate, this will helps the patient to remove the secretions. Steam inhalation, chest physiotherapy, and incentive spirometry. These are all the things which will helps to improve the health condition of the lungs so that they will try to expand normally. So it's very important to perform all these activities. How we can prevent this atelectasis? By proper positioning, deep breathing exercises, and early mobilization. These are all the main things which can help to prevent further atelectasis. Treatment includes bronchial hygiene therapy, in situ spirometry, chest physio, oxygen therapy, mechanical ventilation, and the surgical interventions. These are all the things which we had seen earlier. The follow-up care includes the requires close monitoring and follow-up care. It prevents the further complications and it will help the patient to ensure the proper heal. Thus, in this video, we had covered all the things such as definition, causes, management, clearly like medical, surgical, and the nursing management. So, proper care to be taken in order to prevent further attacks of atelectasis. Thank you, one and all.